I'm Megan Quinn. I'm a professor of public health at East Tennessee State University, and I know several colleagues from ETSU are also on the Zoom call, so thank you all for joining. And I've worked with the group from Center for Development Central America since about 2013, I believe was the first time I came down there, and have known Sarah a little bit longer than that through friends of friends. And I usually was taking a study abroad group down there every summer, and, kind of wasn't able to do that around 2018 for reasons most of us know, but due to some unrest in Nicaragua. And so haven't been able to make it down there since then. And when COVID-19 kind of got started, I was speaking with the group from CDCA and just wondering how we were responding to that, and how things might be different in Nicaragua, how things are changing in their normal work, and kind of what we could do to help. So that's how this got started. And we have a whopping 62 people on here live. And so at this stage, I'm going to turn it over to Sarah and let her share her screen, and she will give us a presentation kind of the current situation, and then we will transition to question and answer after that.
Thank you all so much for doing this with us. I'm very excited. And together, not so excited, but actually it's overwhelming. We're together around the world, we are facing the coronavirus. It has impacted everyone's lives, some dramatically by losing a loved one, some by having to work while in fear of getting the virus, some by working from home, and some by not working at all, but staying at home. COVID-19 has turned realities topsy-turvy, especially in developing countries like Nicaragua, the second poorest country in the Western Hemisphere, where our neighbors face the virus without all the options wealthy countries have, such as adequate funding for healthcare, and are instead looking at the impossibility of social isolation, with the fear of starvation if daily food cannot be bought and sold. With that reality, in contrast to what you might be hearing in the US news, or what you might be experiencing in your own communities, the Nicaraguan government has chosen to be active in identifying cases of COVID-19 and trying an aggressive treatment of public health education without shutting down the country, implementing actions suggested by the World Health Organization that we all recognize are of value, such as social distancing in businesses and government offices, tracking people who come into the country for 14 days whenever possible, and following up with contact tracing, isolating and quarantining anyone testing positive for COVID-19, even while we all understand that some of the tests are unreliable. Mayors' offices are disinfecting with bleach in schools, markets, churches, and other gathering places, while taxis and public transportation cooperatives are coming up with creative hand-washing ideas, while, as you are also doing, encouraging the wearing of masks outside the home. Using South Korean tests, free testing for COVID-19 is happening in public health clinics with people who have symptoms, as well as random testing of people who seem to not have any symptoms. 19 hospitals covering all major cities are equipped with personal protective equipment, ventilators, and medicine, along with doctors from Cuba. As of this week, Nicaragua is seeing an increase in COVID-19, fearful of the impact as it begins to spread in crowded urban areas. As you worry over medical costs and health insurance, here in Nicaragua, healthcare is a guaranteed right, which means that when one does need a hospital or clinic, they leave after treatment with no bill, no debt. Nationwide, over 4 million people have been reached through visits from lay health promoters who give written and oral instructions on how to prevent and identify the virus, while annual vaccination campaigns continue and are even being carried out on horseback. Public schools are encouraging students to study from home, sending in their homework by WhatsApp, but are keeping schools open for children who can't stay home or who depend on the free daily meal for their nutrition. Hand washing stations are at bus stops, schools, and other public places. Nicaragua shares soft borders with Honduras and Costa Rica. When people cross those borders illegally, the Ministry of Health cannot register their health status. This has created an increase in contagion possibility without the aid of routine follow-ups through the Ministry of Health. Together with you, we've been watching the count of COVID-19 cases worldwide. There have been few confirmed cases here until this week, but the government is now reporting cases rising dramatically with community transmission, and self-isolation is extremely difficult in a developing nation. Why? Well, 70% of Nicaraguans work in the informal sector, which means no paycheck and none of the worker protections provided by Nicaraguan labor laws. It also means that if the little bits of daily income stop, children do not eat. Most Nicaraguans live in small basic houses with an extended family of maybe as many as 10 people. These little houses are crammed together, abutting one another. And in the tropical heat, families cannot stay shut inside their tiny little homes. Even though much of Nicaragua is trying to do social distancing, this also poses difficulties for the poor. Public transportation and markets are closely packed, where most shop for their daily meals. The bottom line is that people who are poor in developing countries have to decide between going hungry or risking the virus. And more importantly, they have to decide this choice for their children as well. Can you even imagine a choice like this? I cannot. But with your help, together we can keep Nicaraguans from having to make the choice between hunger and risking the virus. Our small organization, the Center for Development in Central America, the CDCA, aims to give people the freedom of choice. Beginning back in 1994, 26 years ago, the CDCA is the Nicaraguan project of the U.S. nonprofit, the Jubilee House Community, a 501c3 organization, working in health, in education, including public health education, along with potable water and latrines, sustainable agriculture, and sustainable economic development, which mostly focuses on support for small organic farmers, also caught in supply chain crises with COVID-19, just as your farming neighbors are caught. Even organic coffee exports to you have been affected, as U.S. roasters and coffee shops closed this spring, leaving the growers and their families with uncertain income. Nicaraguans face the impact of outside nations' influence on society, health, and economics. Throughout the centuries, foreigners have controlled Nicaragua, restricting its right to flourish or to choose its own path. Most recently, in 2018, there was a political uprising backed by the U.S. State Department with the goal of overthrowing the elected government. The U.S. imposed sanctions on Nicaragua and continues to impose new sanctions, which limit the choices this small country has in this time of a pandemic. These sanctions hurt the small farmers, businesses, and all aspects of the Nicaraguan economy, including our work. Because the U.S. State Department posted high travel alert levels in 2018, volunteer delegations suddenly canceled, resulting in a loss of cash and medical donations to the CDCA, representing at least $150,000 annually, a large chunk of our health clinic's budget. Then, as delegations were just starting to return with their donations, early this year, COVID-19 hit, and the budget funding loss continues. Especially impacted through loss of volunteers, our project, the Nueva Vida Clinic, has been hit hard financially. For over 20 years, our clinic has been serving in a poor barrio neighborhood of about 16,000 people. This barrio of Nueva Vida was founded in 1998 as a refugee camp after Hurricane Mitch hit, the deadliest hurricane of the 20th century. Like all the poor around the world, the people in Nueva Vida are a prime example of those suffering from all the hardships I've mentioned above. Our clinic serves these people in 3 rural communities, as well as many in Ciudad Sandino, the city that encompasses Nueva Vida. With a population of about 180,000 people, Ciudad Sandino is the most densely populated and poorest city in Nicaragua, and our home. Our clinic is not set up to treat patients with COVID-19. Rather, we are working to continue treating our regular patients while keeping them and our staff safe. Many of our clinic staff have been working with us for 10 to 20 years and have a variety of pre-existing conditions, all of which make protecting them a major focus. We are worried, but together with your support, we're not letting our worry paralyze us. We are working hard to continue serving patients in our clinic programs, adapting to address the coronavirus as we see many probable cases of COVID-19 in Nueva Vida. We have instituted social distancing by marking on the floor where people can stand in line. We also seat patients apart, both outside as well as inside. We teach patients several times a day about coronavirus symptoms and how to protect themselves. We have hand washing stations in front of all entryways into the clinic. We are awaiting thermal thermometers and have pulse oximeters to test patients and staff as they enter the clinic. Patients with symptoms of COVID-19 are isolated and sent to a public clinic that does have testing abilities. We fumigate with bleach solution 3 times a day in the clinic, and if a patient appears to have COVID-19, we fumigate again after the doctor sees the patient. Our clinic staff wear masks, face shields, and lab coats, which stay at the clinic for laundering and cleaning. Even though most of our PPE are handmade, they do provide some protection. Beginning mid-April, we limited the provided services to only essential care, putting our numerous support groups and home visits on hold to avoid putting patients and staff at risk. Our clinic staff are continuing to evaluate the situation and will continue to adapt as need arises. Currently, our radiologist does ultrasounds for critical need and prenatal care. Our pediatrician treats sick children. He continues to treat asthma in children. This is critical, although we have stopped all nebulizing treatments, instead using individual inhalers with disposable cups as masks for babies and young children. Our general physician sees patients in the clinic. Our nurse does prescribed injections, EKGs, as well as family planning, including birth control implants, IUDs, pills, and injections. Our pharmacy has glass all around it to limit germ transmission. We are stressing that the elderly and patients with diabetes and hypertension send younger members of their families to the clinic's pharmacy to collect their monthly medicines rather than coming in themselves. Preventive care, which has been an integral part of our dental clinic, is postponed for now to protect both staff and patients. Our dental clinic is only doing emergency restorative care and extractions. Our laboratory continues to test for diseases. Gastrointestinal parasites are a problem in Nicaragua. Our lab technician is very careful in handling feces while testing for what kind of parasite may be causing diarrhea. Glucose levels for both chronic diabetic patients and emergencies are monitored and tested. Our eye vision testing and glasses service is on hold temporarily, as are all our normal support groups, such as our girls and boys groups, all our mothers groups, breastfeeding group, our asthma group, as well as training classes for our 30 lay health promoters who remain the eyes and ears of public health outreach, notifying clinic staff of illness within their neighborhoods. Our therapist continues to treat people in the clinic. Because virtual counseling isn't an option, she and the patients are maintaining social distancing and wearing masks. Mental health is a critical service, especially when dealing with domestic violence, poverty, and the added stress of COVID-19. Most of her clients are women and children. We are all facing our fears with this pandemic, but we don't have to let fear dictate our decisions, and we are not in this alone. Together, we can make a difference. Together, we can provide care and support to our farmers, even though more and more limited funding is stretching the budget to the breaking point. Together, we can provide health care while protecting our dedicated staff, even though it is a challenge, to say the least. Together, we can protect our wonderful dental staff while still providing dental care regardless of our fear. Together, we can offer mental health aid. even with masks on faces and no hugs for the kids who desperately need them. And together we can set up and maintain protection for our clinic staff and patients in spite of the cost. Although all of this is hard and sometimes seemingly impossible, the CDCA has a fantastic staff full of loving, caring people dedicated to the service of the poor and making options possible for them. Will you help? For just $10, you can provide washable masks with a replaceable filter for a medical provider. For just $25, you can provide one patient with their monthly diabetic medication. For just $30, a medical provider can have a set of washable gowns. For $50, a woman trying to be responsible to herself and her family can receive a birth control implant lasting 3 years. For $75, bleach disinfectant for the clinic's monthly need can be purchased. For $100, a hypertensive patient dependent on consistent medicine for life can receive 1 week's supply of medication. And for only $800, you can fund the Nueva Vida Clinic operations completely for 1 whole day. Better yet, a recurring monthly donation of any size allows the clinic to plan for the best possible service for all. It's easy to set up a recurring donation online. You can help. Together we can bring hope in the midst of COVID-19. Our web address is at the bottom of the screen, and snapping the scan code on your phone will take you to our donation page. We need you. Many of you have responded. For that, we thank you. Please help.
All right. Thank you so much, Sarah. That was very informative. And I think for many of us paying attention to what's going on with COVID-19 in the US, or if you're living in Belgium or other places in Europe, we're paying close attention to what's going on around the world. And for a lot of us on this call, it seems like we've traveled to Nicaragua and we've worked with the CDCA before. So kind of paying attention to the needs that are going on there. I know with the groups that I've traveled with down there, we've done projects on women's health, we've done projects on type 2 diabetes, and worked with the health promoters to really understand what are those needs in Nueva Vida. And it is a bit nerve-wracking because the amount of chronic disease that does occur in Nueva Vida is pretty large. And so the impacts of COVID-19 for some of those patients who are at high risk could be fairly detrimental. So I think Sarah did a great job of giving us a broad picture of what's going on and kind of letting us understand what they're doing and what kind of their needs are moving forward. One of the reasons why I really like CDCA's work is because they've been there for so long, and they've been in Nicaragua for 26 years, and they're really invested in the community and working side by side with everyone and really letting the local individuals take the lead. So those are great things about CDCA. I see that Claudia has posted the donation page in the chat. So if anyone feels inspired to donate, that would be great. If you've got even a little bit, goes a long way. And I think the monthly recurring donations, even if it's like $10, which seems like a meal out to us, can make a big difference there, as Sarah showed you. So I'll ask the first one that came through and go ahead and transition over to the question and answer portion that I think Becca is going to be the lead on. And so I'll give you all the chance to just unmute yourself when you're ready to ask a question. But David Paul posted a couple questions in the chat, so I'll go ahead and ask those out loud for you, Becca. So would like to know what government-run or supported clinics there are in Ciudad Sandino, and how those are or are not meeting the needs of the population other than Nueva Vida. So we'll start with that one.
Hi, everybody. Our Dr. Jorge Flores, who's been with us for 21 years, was supposed to be here with me today, but he woke up with a fever and aches and pains today, so he is not here. So I'm going to take on the answering of the questions. As to the question with what clinics are available, in Ciudad Sandino, we have one hospital, which is just become technically been rated as an actual hospital, but it doesn't have 100% of hospital services. It does have emergency services. They do births and things like that there. So that is the main center. And then there are 6 other health posts throughout the city. We have about 180,000 people living in Ciudad Sandino. So there's 6 other health posts, one of which is in Nueva Vida, and our our pediatrician and our general practitioner both work there half-time and work with us half-time. So they're back and forth between our clinic and the MINSA clinic, the Ministry of Health clinic there. It's a tough question of whether or not, how those clinics are or not meeting the needs. I think one thing that we're battling a lot here in Nicaragua right now is that there's been a lot of misinformation about the COVID-19 situation here. Part of that is political. People in opposition to the current government have been trying to make it look like the government is unable to handle the COVID situation. But there's been just extreme amounts of misinformation, both malicious and also, I think, just gossip basically getting passed around as if it were fact. And so at this point, we have a situation where a lot of people are afraid to go to the public clinics and afraid to even call the hotline number that the Ministry of Health has set up, although they've handled more than 100,000 calls since they set up that number. But people are not wanting to go in to get tested. So here people say they're not testing anyone. They're not seeing patients at the hospital. And then when you actually ask the particular patient who went, well, with possible COVID symptoms they were seeing, they did get medicines. Maybe they didn't get a test, or maybe they did get a test depending on the patient. And luckily, I haven't fallen sick yet, and I haven't got in myself to see what the process is when one has COVID-like symptoms. But what we've heard from other people who have gone in there is that they are still sending patients that are probable COVID cases or COVID symptoms from the health centers. They're sending them to the hospital here in Ciudad Sandino. The hospital has a special area set up to deal with patients with respiratory issues. And those patients are being tested if their symptoms look like COVID to the doctors who see them. There seems to be a shortage of tests, which is not surprising given that there seems to be a shortage of tests in most countries around the world. And of course, we have to take into account that the tests are not very accurate either. So as of this week, when the Ministry of Health yesterday gave their weekly press conference on the situation, they began talking about probable cases and including those numbers of probable cases, not just the actual cases that had tested positive. But I think that it is a real issue that people are not wanting to go in. So the misinformation out there says that the government is hiding cases, but if people don't go into the Ministry of Health and go through that process and get tested, then how does the government know that those cases exist? It's a real issue. And if people are hiding cases from the government, then that makes it difficult to do contact tracing and follow up on it. So those are some issues. I see another question up here. Megan, should I go ahead and answer?
Go for it. You have another one from David Paul, and then before me, and then you have another one from James Poke.
Okay. Question is healthcare free? Is it true that there are situations where medicine is prescribed in a government clinic but is unavailable from that clinic, so patients have to pay out of pocket from a private pharmacy? The Ministry of Health gives out medicines for free to patients. They're prescribed those medicines. There are times, particularly certain times of the month, when like that particular health center or hospital hasn't yet received the monthly medications, and they will be short on medications. In general, there are certain medications that are available from the Ministry of Health for basically everything, but you might get one and not another. Most of the time, I think that people get medicines prescribed to them that the pharmacy has, but the doctor might say, if you can, you should try to get this medication as well. And then in that case, yes, they would have to go to a private pharmacy. So there are cases where people don't get 100% of the medications that the doctor might prescribe from the Ministry of Health clinic.
So asking about the sudden increase in numbers from yesterday's announcement of numbers, this would also include a lot of recoveries, which suggested that there must have been undetected cases which have appeared. Is this a result of increased testing, which has identified more people, even if they have recovered, or what is the other explanation?
Yeah, we did see, we had very few cases. Last week, it was at 25 cases and total, and this week the total is 279, of which 63 are active cases, 199 are recovered cases, and 17 deaths. I think the jump we're seeing in there is reflective of two things. One, last week is the week that we began to see really community spread here. That is where it's, you know, growing exponentially. Before that, it was pretty well controlled. And so this is the week where we start to see these jumps. Hopefully it doesn't do this too much. You know, we hope we can flatten that curve. So I think that's one thing. The other thing is that the government did begin talking about probable COVID cases as well. So all along they had been mentioning the number of cases that were positive and also people they had in isolation that they were doing follow-up with. They weren't saying earlier that those were probable COVID cases, but I think those are the people that they're now saying, yes, these are the probable cases. So because they hadn't been confirmed with a test, they weren't counting those as a positive case. Now I think they're being a little more loose about the definition and adding in that those probable cases because, as I mentioned, you get a lot of false negatives with the testing, and depending on, as far as I understand it, when you do the testing, it can be a false negative or a false positive. So they're going a lot more now, it looks like, from the numbers with symptoms and how that patient is reacting. Yes, there's a question from Jim Ludden. What is your budget shortfall since this epidemic hit? I don't know if you have actual numbers, Sarah, who is laughing there with her mute on, but I do know that every week we meet and we look at our budget for, you know, how is it looking for this week and what does this month look like? And at the beginning of every month we go, wow, we're not going to make it through this month. And then you know, something happens, and as the month goes on, we get closer and closer until in the end, we've managed to pay our bills at the end of the month. So,
we
yes,
currently, today is what? Today's the 20th May, and we currently can enter June in the black.
June.
You know, 10 days from now.
We're going into June in the black is what you're saying.
Into June in the black, unless something drastic happens in the next 10 days. We are very grateful for that. That doesn't mean that everything's all tidy away in all the right pockets for all the right things, but it does mean that the staff are still getting paid. No, we haven't had to fire anybody. That's remarkable. And we keep doing whatever we have to do for COVID regardless, just because it has to be done.
And Sarah and Becca, kind of the lack of delegations over the long term, that has a potential for quite a big impact in terms of budget. Is that correct?
Yeah, we usually figure that our volunteers, because we charge a per diem, and then we don't actually have to use all of that for their expenses. We usually figure that when we have a full set of volunteer delegations that we should end up with about $100,000 coming in cash. And then many of them are medical delegations and they bring medical supplies with them, or, you know, office paper and staples, you know, whatever it is. And we figure that at about another 50,000. So when no delegations, when everything stopped in April of 2018, that is when that money stopped coming in. And we had delegations booked solid through 2018 who just couldn't come. Then we had a few who were going to come in 2019, and then they couldn't come, or almost all of them couldn't come. A couple of very small ones came anyway. This year, we thought we were starting back up. We had a lovely group coming in March, and 3 days before they were to show up, all the flights got canceled. And so they couldn't come. And they very generously left us their room and board money to use as donation, but we have no other delegations for this year. So it's serious. That amount of money and those donations are roughly a third of the clinic's budget, a third, close to half of the, and so see, we're doing this. We're trying to make up the difference.
Okay, Becca, you've got a few more questions in the chat there for you.
Jill Clark Gullub is asking, is there hope to get a lot more tests, and how are sanctions affecting the availability of tests? So far, I believe that Nicaragua started immediately following the announcement of this pandemic. Nicaragua got some tests, and since then they've received, along with the other Central American countries, I think they've received something along the lines of 52,000 tests from South Korea that have been bought from South Korea through Central American group of countries and brought in. I hope that that will happen again, so that there will be more tests. I don't know that sanctions are affecting the availability of tests. Sanctions are certainly affecting things here in Nicaragua. For those of you who don't know, the United States has sanctions against Nicaragua, and it is affecting some of the things that are being brought in. We're now seeing, because of COVID and a combination of COVID and the sanctions, we're now seeing things that are slowly disappearing off of the off of the shelves, bizarre things that are no longer available. So some of this is affected. We're also seeing, for example, our clinic gets money from the Rotary International Foundation for a couple of projects. We have to fill out endless forms that take 3 weeks to 5 weeks to get approval before we can spend money because of those sanctions. We haven't had any problem actually getting it through in the end. You know, they want to know who our providers are, and mostly the providers we work with are like, you know, the guy down the street, as opposed to someone who, you know, a company that would be affected by sanctions. So I don't know about the testing. We're hoping that there are going to be more tests available. Now there's so many questions. Yes.
Well, I was going to say the other part of our work that is affected by sanctions has to do with the agricultural work, because between COVID and the sanctions, things like you have a whole container of organic peanuts or organic sesame or whatever heading north, and they get stopped at some port because those officials aren't working because they got sick with COVID, or that office got shut because of COVID or whatever. And then it gets delayed, and then it gets extra inspection coming into the US. And how do you maintain the fact that it's supposed to be organic and keep it organic and get it to the customers before, I mean, this is hot weather. So before just the normal germs that start to, you know, stuff that starts to grow in seeds, if it sits too long, it can't be sold to the buyers at the other end. And then farmers don't get their pay. And so it's that whole business of farming is a huge thing that sanctions and COVID together is affecting the timing and levels of inspection and headache on that.
Yeah, so I think it's safe to say actually that I think, and Mike can correct me if I'm wrong with a finger wag, but the peanuts that we shipped to the United States got stopped and got a red light for inspection because they were from Nicaragua and there are sanctions against Nicaragua. So that is definitely affecting us. There's a few more questions over here. Leslie is asking how our work is coordinated with the government. We are a Mission International, registered with the Nicaraguan government. We're a U.S. nonprofit working in Nicaragua. So we coordinate with a whole host of Nicaraguan government offices to get our permissions to work here. And that includes working with the Ministry of Health on the clinic work that we do. So our clinic is registered with the Ministry of Health, and we send them monthly reports, and the Ministry of Government and the tax office and all of those people receive reports from us, and some of them were just out here today getting information from us. So we do a fair amount of coordinating with all those offices. Chris is asking, is there PPE available from local sources? To a certain extent, masks, the surgical kind of masks still seem to be pretty readily available, but they now cost actually more than it cost us to make the cloth ones that Sarah showed in her slideshow. So we actually have been using cloth masks for our staff, and we're handing those out to patients with possible COVID symptoms at the clinic. And we're making some with a filter in them for staff. In terms of other, you know, the hats and the booties and the, you know, the whole getup, those are very difficult. We have a friend who works at a pharmacy who calls us every time something is coming into the country and says, you know, this is, you know, we've got the gowns. Do you guys want these gowns? And they're way more expensive than they were before. And they're, when they're there, you have to buy them because you won't see them again for a little while. Just this week, Costa Rica has stopped all truck traffic going through Costa Rica. So right now there are 1,000 trucks between the Nicaraguan city of Rivas and the border with Costa Rica, all waiting to get into Costa Rica. And that is definitely affecting this, the movement of goods in Central America, including things like PPE. So we'll have to stay tuned on how that works out. David Paul is asking, apart from the period of COVID, how as good as the public health system is it safe to assume it hasn't been adequate to cover the basic health needs of the population in Ciudad Sandino, and that's why your clinic was formed? When our clinic was formed in 1999, that was right after Hurricane Mitch. It was a different government and it was a very different situation. Healthcare was actually not free in Nicaragua at that time. Basically, if you needed surgery, you had to bring in your own sutures to get your, and everything in between. So things were not free, and it was very difficult for people. Most of the folks that we serve today, they would, if they could get into a public clinic to be seen, they'd be given prescriptions for medicines that they couldn't afford. And so that's why our clinic was set up. Since 2007, when healthcare became free again in Nicaragua, the government has indeed struggled to provide quality healthcare. Every year since 2007, the healthcare budget has been increased to try to provide that care for people and improve the quality. There have been 18 new hospitals built in the country since then. We've seen the people that we work with get increasingly better care from the Ministry of Health. That having been said, we try to work very closely with the Ministry of Health to complement what they're doing instead of, we are in no need to compete with the Ministry of Health. We want to complement what they're doing so that our patients get better care. So as they have increased, as they've done a better job of seeing patients and attending patients, we've begun to do increasingly more specialized work at the request of our patients. So for example, we now do ultrasounds at our clinic. That's something that you can get in the public health system, but depending on how urgent your case is, you might wait a while for it. And so we can do it for much cheaper than a private clinic would do. We charge less than $3 for our ultrasound and visit with the doctor plus medicines. At a private clinic, you're paying $25 or $30 minimum. And we have dentistry, which is something that people find still difficult to get in the public system. We do lab tests, and glasses are some things that people are finding harder to get in the system. Yes, Sarah, you wanted to add something?
Yeah, I was going to say a couple of our physicians we only have one physician who works full-time with us outside of the MINSA National Health System. Our other physicians work part-time, which means they are also working within MINSA the rest of the time, which means they're really on top of what is and isn't available at MINSA and can guide us in what is needed to serve people better that is harder for folks to get through MINSA. And so this level of communication is really, really important. And that's what guides, what is the service that needs to be offered.
Okay. There's a question from Robert Alexander about the misinformation. We've been saying about the misinformation about the situation. What are we to make of reports about rushed burials and secret meetings among medical personnel in places like Chinandega and Esteli? Are you saying those are all a hoax? There's a lot of information that is indeed hoax. We've seen videos that are basically, acted out videos with people burying folks in the middle of the night. Unfortunately, those reports have been picked up by major media sources, and so those are the headlines that are out there. We tend to have a good handle on what's going on here in Ciudad Sandino. So I can't from personal experience say what's happening in Chinandega and in Esteli. We do know that there have been some deaths this week in Ciudad Sandino that are unconfirmed but probable COVID cases. And that has everyone alarmed. We've not heard or seen any secret burials. The cemetery is actually on a major route, and everyone can see, the grave diggers out there. So there's not secret burials happening in Ciudad Sandino. And we do know that a lot of the misinformation that's out there, when you trace back these things that have come out, you can see that a lot of them are coming from opposition political parties and folks who are leaders in that. So you have to be very careful with the information that you see that seems alarmist. And unfortunately, everyone is really susceptible to these reports, to alarmist reports. Everyone wants to pass them along and let people know that these things are happening. And that contributes to the problem where now we have patients who are probable COVID cases that don't want to go into the hospital because they're afraid they're going to, die and their family members will never see them again. So that is problematic in fighting from a public health perspective. Having patients hiding that they have the virus is very problematic to fighting it. Leslie is asking, hasn't the lack of foreign visitors in Nicaragua saved the country from being exposed to the pandemic? We've seen in Costa Rica, which had many more tourists coming to Costa Rica, they got a lot more cases a lot more quickly. So probably it helped slow the start of COVID in Nicaragua, but because now we have community spread, the lack of tourists isn't, what it did is basically gave us more time to prepare. Because we have fewer foreigners coming through the country with possible COVID cases. Jess is saying that some of our Arms of Love children have been treated at the dental clinic, which is amazing. Yes, we are actually working at the dental clinic. We've stopped all of the dental work right now, but we have, under normal circumstances, children coming from actually all over the country from the orphan network programs to be seen at our dental clinic. And they're being seen every 6 months to get their teeth cleaned. And one of the things that our dental staff will probably be doing now that they'll have more time on their hands without seeing all those children is going through those files and actually tracking how their dental health has improved during the time that they've been coming in to be seen at our clinic. Doug is saying we might point out that many people in the US are being buried without funeral services and more quickly than usual. That's absolutely true. I think the situation is similar everywhere for people who've died who have possible COVID-19 cases. Jill is saying, do you have information you could share about experiences of patients having in public hospitals when treated for COVID? And please don't forget to tell everyone about the Citizens Observatory on COVID-19 and its mysterious experts. Yeah, there's a lot of the information that's coming out is from something called the Citizens Observatory on COVID-19, which has been founded by members of an opposition political party. They say that they have thousands of experts that are working with them, and they are basically treating themselves like a parallel organization to the Ministry of Health. They're reporting numbers of cases they say are from healthcare professionals. We don't know where those healthcare professionals work or where they are in the Ministry of Health system. They say they estimate a certain number of cases. We feel it's very dangerous to be putting out their parallel information instead of working together with the Ministry of Health. It's concerning to see that media is outside of Nicaragua, media are reporting what the Citizens Observatory on COVID-19 is saying as if it were true, but they don't give any kind of, they don't give sources and they don't give any kind of idea of who they are and how they come to calculate the numbers that they have. So it is extremely inflammatory and making people very scared. In fact, one of our staff members was theorizing with me yesterday that he thinks that some people are getting sick and even dying from basically the worry about this illness, that people who have pre-existing conditions, they get so concerned about this after seeing all of these inflammatory reports that they actually do become ill from it. So we have sent, this is to Jill's question, we have sent the patients who come to our clinic with COVID-like symptoms, we have sent them to the Ministry of Health. We don't often get follow-up. We don't know, did they go or did they get seen? We do know one patient who was quite ill when he's a regular patient of ours who was quite ill when he came to our gate. We sent him in directly to the Ministry of Health. I was then later told he wasn't seen, but he actually had been seen. He did receive medication. As far as we know, he didn't get a test. So that may indicate there were no tests available, and because he's elderly, they weren't giving tests. That's one theory, but also could be true that they saw that he was given antibiotics which may be that he was being treated for something that they could see, which could be a secondary COVID infection, or could be in fact something entirely different. So it's very hard to know what's happening. We do know that the cases early on, there were cases. Now the identity of patients who've tested positive is being protected, so no one is, the government is not naming names. But some of the people, one particular patient who died early on, their family came out and thanked the Ministry of Health for the excellent care that that patient received. So at least in the beginning, people were reporting very, very good treatment.
I just wanted to add that we have found that the Johns Hopkins University Global COVID-19 map charting, the Ministry of Health here was making daily reports, and they've switched to a weekly report, which they do on Tuesday morning. And by Tuesday night, the Johns Hopkins University global map was reflecting the same information that the Ministry of Health was putting out. The New York Times map was a little bit slower. It didn't pick it up until this morning. And the Central America group, the CISCA group, they're reporting essentially the same numbers also. So those are some places to go look for what seem to be coordinated, responsible kinds of numbers.
David has asked a good question about our clinic and patients paying. I did mention that patients often pay for their ultrasounds. We do charge our patients something at the clinic. Most of clinic consults cost less than $2 for the patient to see the doctor and get all their medications, as well as the lab tests that the doctor orders. But that having been said, about a third of our patients pay nothing. Those are patients who are have been evaluated by our staff because to be people who are at extreme risk, people who have a difficult economic situation and can't pay. And in that case, they actually just get a different colored card that they come in with every time, and they never have to pay. The rest of those numbers are patients who are in one of our programs. So any of our health promoters, any of the people who are in the pregnant women who are in the New Moms program, the Moms and Babies program, the Moms and Toddlers program, the teenage programs, asthma patient programs, all of those folks receive their care, all of their care for free. So if you're in one of our programs, then you're not paying at the clinic. We don't charge more for medicine, so patients do get their visit with the doctor as well as all of their medications. And we feel that's important because a lot of times patients don't have the money to pay for medications, so they come see the doctor and then they don't get better. And we always try to make it workable for people if they really can't pay. But we charge for basically the income from what patients pay just about covers. Before COVID, and we had to buy so much bleach, was just about covering the cleaning supplies for the clinic, but not the people who do the cleaning, for example. So that it is a very small portion of our budget. But one of the things that we found is that in charging something for at the clinic, it gives the patients the dignity of being a paid patient and being able to feel like they can demand quality care as well and really take ownership over their health care. But we have a lot of ways for people to not have to pay if they can't afford to. So we try to make it very affordable. Jill is mentioning psychological warfare. Yes, that is indeed what's going on. And Diane is saying that that people who are putting out misinformation, maybe they're being paid by the US. I do believe that some of the individuals involved with the Citizens Observatory on COVID-19 or their organizations have received funding from the National Endowment for Democracy. So that is something that can be traced. Yeah.
Does anybody have any final thoughts? I see some applause. Oh, Diane's got one for you. Do you have a specific fundraising goal you are reaching for in terms of monthly or weekly?
I'll let Sarah handle that because I immediately think in the millions, and so I'll let Sarah answer that one.
Here's an interesting number. If every person who had ever come down here as a volunteer gave us $25 a month, we would not have to do any fundraising. Just little bits. what we would love are for everybody, and then in your social circles, and then in those people's social circles, to commit to what you can do per month, so that the clinic can count on it. It's so crazy, you know. Kathleen says, "Oh well, we need 2.5. What is it? 2.5 million to endow the clinic so that it can run off of the interest, because the clinic has no way to do fundraising on its own." So if you've got that in your back pocket, great. But if you don't, what we really need is to be able to make the monthly bills and do what we need for COVID. And I don't really have a number for that, except that our budget last year was $800,000. That doesn't count loans to the farmers and stuff. That just is, regular everything, paying our staff and all. And a huge portion of that is the clinic and clinic staff. And I know our time is about up, and I just want to say thank you again. It's so good to see everybody. And I'm flicking back and forth between the little screens on my laptop so I can see everybody. So it's been wonderful. Thank you, Megan, for hosting this.
Yeah, thank you everyone for joining. And Sarah, I took several pictures so that you all have them of the various little faces in the boxes on our screens. And most people have requested the slides. So I think if you want the slides and Sarah or Becca has your email already, then you're good. Yep. Perfect. Well, thank you all for joining.
So much.
Thank you all.
Sarah and Becca.